Nobody wants to talk about this part. Every retirement abroad video shows you the beaches, the sunsets, the cheap rent, the beautiful markets. They show you the life. What they don't show you is what happens when something goes wrong. When you're 63 and it's 2 in the morning and you can't breathe right and your left arm feels strange and you're not in Kansas City, you're in Penang. That moment, that exact moment, is the reason most Americans never pull the trigger on retiring abroad. Not the language barrier, not the visa paperwork, not even the loneliness. It's this. What if I get really sick? What if I have a real emergency? We're going to answer that today with actual numbers. Not what a general practitioner costs, not what a routine checkup runs. We're talking about emergency rooms, CT scans, cardiac procedures, open heart surgery. The kind of bills that would bankrupt you in the United States, and what that exact same care costs in the places Americans are actually retiring to right now. Here's a number to hold in your head while we go through this. The average cost of a single, uncomplicated heart attack, hospital admission, stents, ICU stay, 3 days inpatient, in the United States, $117,000. The same care, same quality, English-speaking staff, internationally accredited hospital in Penang, Malaysia, under $12,000. That's not a typo. That's not a third world clinic. That's a JCI-accredited hospital that treats medical tourists from Singapore, Australia, and the UK, people who fly there on purpose to get treated. Stay with us until the end, because we're saving the most jaw-dropping number for last. It involves a country you've probably never considered, a procedure that costs $180,000 in the US, and a bill that came in under $8,500. Before we get into the numbers, here's how we built this video. We went through real billing records and first-hand accounts posted by expat retirees in forums, Facebook groups, and community boards across Southeast Asia, Latin America, the Caribbean, and Europe. We cross-referenced against the Joint Commission International Accreditation Database, that's the global gold standard for hospital quality, and against International Living's annual healthcare rankings, the Numbeo Cost of Living Index, and the Medical Tourism Association's pricing transparency reports. We also pulled from the documented experience of retirees in communities like Internations, Expat Exchange, and the American Citizens Abroad Network. These are not cherry-picked best-case stories. We looked for emergency situations specifically, the scenarios that keep people up at night, ER admissions, cardiac events, fractures, strokes, cancer diagnoses. The stuff you can't plan for, because that's the real test, and the results honestly changed how we think about this. Let's name the fear precisely, because vague fears are the ones that stop you cold. What most Americans are actually afraid of when they imagine getting sick abroad isn't bad care, it's the unknown. They picture a dingy clinic with flickering lights, a doctor who barely speaks English, no MRI machine, no specialist, and a medevac bill that ends up costing more than a year of living in the US. That fear made sense in 1995. In 2026, for the specific destinations where Americans are actually retiring in large numbers, it is largely outdated, and the numbers prove it. Here's what that fear is actually worth financially. The average American over 65 spends $7,000 a year out of pocket on healthcare, even with Medicare. A single major cardiac event can cost $100,000 to $300,000 in out-of-pocket and supplemental insurance costs combined. Medical debt is now the leading cause of personal bankruptcy in the United States. The system you're staying home to protect yourself with is the same system that is, statistically speaking, more likely to financially destroy you than the hospitals in Bangkok, Penang, or San Jose. That's the inversion. Let it sit. Let's start with a real scenario. An American retiree, 67 years old, living in Georgetown, Penang, with chest tightness, shortness of breath, and that classic radiating arm pain. His wife calls an ambulance. He is admitted to Gleneagles Penang, a Joint Commission International accredited private hospital, within 25 minutes. What happens next? ECG, blood work, troponin levels, chest X-ray, the standard cardiac workup happens within the first 2 hours. He's seen by a cardiologist, not an ER generalist, within the first 90 minutes. A coronary angiogram is performed. 2 stents are placed. He spends 2 nights in the cardiac ICU and 1 additional night in a private room with a television, air conditioning, and a nurse call button that actually gets answered. His wife can stay with him. The staff, doctors, nurses, the billing coordinator, all speak fluent English. The itemized bill: emergency admission, $120, cardiology consultation, $65, angiogram procedure, $1,800, 2 drug-eluting stents, $3,200, ICU care, 2 nights, $900, private room, 1 night, $180, full pharmacy, $340, total, $6,605. The same procedure, same stents, same ICU stay, same outcome at a U.S. hospital. The median cost is $117,000. Without comprehensive insurance, your exposure after Medicare and Medigap can still run $15,000 to $30,000 or more, depending on your coverage gap. And that's assuming everything goes smoothly in the billing department, which, as anyone who's dealt with U.S. hospital billing knows, it often doesn't. The Penang healthcare system draws patients from across the region for exactly this reason. Gleneagles, Penang Adventist, and Island Hospital are not charity institutions. They are profitable, internationally accredited medical centers that compete on quality and win. Doctors are routinely trained in the UK, Australia, and the US. Equipment is current generation. The difference in cost is not a difference in care. It's a difference in the economic structure of the healthcare system itself. Thailand doesn't make the typical retirement list for English speakers the way Malaysia or the Philippines does. But on pure medical tourism data, it is arguably the most developed medical travel destination on the planet. 1 million patients per year, including more than 520,000 international patients. It has its own international patient services department, translators for 30 languages, and a concierge service that coordinates everything from admission to hotel. It is, by any metric, a serious world-class hospital. Now the numbers. An MRI in the United States, depending on the machine, the body part, and whether you're in a hospital or standalone imaging center, runs between $400 and $3,500 without insurance. With insurance, your out-of-pocket after deductibles commonly runs $200 to $800. In Thailand, a brain MRI at Bumrungrad, $180 to $250 paid directly, no insurance required, no pre-authorization, no waiting 3 weeks for a slot. You book it, you go, you have results the same day. A CT scan of the chest at a Bangkok private hospital, $120. In the US, $500 to $1,800. A full cardiac stress test with echocardiogram, $280. In Bangkok. In the US, $1,000 to $2,500. Here's what the retirees living in Chiang Mai will tell you, because there is a substantial, organized American expat community there. They don't fly back to the US for medical care. They fly to Bangkok. And the flight from Chiang Mai to Bangkok takes 75 minutes and costs $40. That's their, quote, going to the doctor routine. It costs less, takes less time, and delivers results faster than most Americans experience in their own hometown. The catch in Thailand, and it's a real one, Thailand is not English-speaking in daily life the way Penang or the Philippines is. In hospitals, yes, major international hospitals have the English coverage. But navigating the broader healthcare system, finding the right specialist outside the big international hospitals, reading prescription labels in smaller towns, you need to know what you're doing or have a trusted local contact who does. This is manageable. It's not invisible. Costa Rica is one of the most established retirement destinations in the Western Hemisphere, and it has a public healthcare system, the Caja, formerly the Caja Costarricense de Seguro Social, that legal residents can access at extremely low cost. Monthly contributions for retirees run approximately $70 to $100 a month based on income, and that buys access to a system that the World Health Organization has consistently ranked above the United States in overall health system performance. But the scenario that changes minds is the private side. An American woman, 71 years old, living outside San Jose. She falls on a wet tile floor, the single most common serious injury among expat retirees in tropical countries, and fractures her hip. This is the procedure that, in the US, averages $35,000 to $65,000 for the surgical repair alone, plus $15,000 to $30,000 for inpatient rehabilitation. Her total bill at Hospital CIMA San Jose, a sterility assurance and accredited private facility affiliated with the Hospital Corporation of America, so yes, a genuinely serious institution. For the surgical hip repair, 3 nights inpatient and a 10-day outpatient physical therapy course, $14,200. And CIMA's the expensive private option in Costa Rica. CIMA's where you go when you want the full English-speaking, internationally accredited, American-style experience. The public Caja system would have cost her, as a legal resident with contributions, close to nothing out of pocket. The trade-off there is longer wait times for non-emergency procedures. For a genuine emergency, even the public system moves. What most retirees in Costa Rica do: keep the Caja for routine and ongoing care, carry international health insurance for catastrophic coverage, and pay cash for the private system when they want speed and comfort. The total annual cost of that 3-layer approach runs around $3,500 to $5,000 a year. Compare that to the average American retiree's healthcare spend of $7,000 a year with Medicare, plus the chronic anxiety of gaps, billing disputes, and surprise bills. This is the one. If you're still skeptical after everything we've covered, this number is the one that dissolves the argument. Open heart surgery, specifically coronary artery bypass grafting, CABG, a multi-vessel procedure in the United States, $150,000 to $200,000. That's the median, not the catastrophic outlier. In Germany, which has one of the best healthcare systems in Europe, $35,000 to $45,000. In Thailand, $15,000 to $25,000. In India, at Fortis, Apollo, or Narayana Health, all internationally accredited hospital systems that perform thousands of these procedures every year, $7,000 to $10,000. $7,000 for open heart surgery, with a board-certified cardiac surgeon who trained at a British or American medical school in a hospital with state-of-the-art equipment, post-operative ICU care, and a patient recovery success rate that, at institutions like Narayana Health in Bangalore, is documented and published and comparable to the best hospitals in the United States. Now, India is not a retirement destination in the traditional sense for this channel, and we're not suggesting you move to Chennai for the beaches. But here's why this number matters enormously for every American considering retiring abroad anywhere in Asia. India is typically a 4 to 8 hour flight from Bangkok, Penang, Singapore, or the major Philippine cities. For American retirees living in Southeast Asia who face a cardiac diagnosis requiring major surgery, India, specifically centers like Apollo Hospitals, which has 70 hospitals and has performed over 150,000 heart surgeries, is a genuine, documented, high-quality option. People fly there specifically for this. Medical tourists from the US, the UK, and the Middle East do it routinely. The catch? Getting there when you're seriously ill is not simple. You need the diagnosis in advance, you need to be stable enough to fly, and you need to have done the research before the crisis, which is exactly the point of this video. Cancer diagnosis is the other scenario that freezes people. What happens if you're in Cebu and you find out you have early-stage breast cancer, or a prostate diagnosis, or colon cancer? Do you pack up and fly home? Many expats don't. Makati Medical Center in Manila, St. Luke's Medical Center, and the Chonghua Hospital in Cebu City are all internationally accredited, cancer treatment capable, and operate oncology departments with equipment and protocols that would be recognizable to any American oncologist. Radiation therapy in the Philippines for a standard 30-session course, $4,000 to $6,000. In the United States, $30,000 to $100,000 depending on the facility and coverage. Chemotherapy protocols, priced on a per-cycle basis, run 60 to 75% less than U.S. costs. Is Philippine oncology as cutting-edge as MD Anderson or Sloan Kettering? No. For highly experimental, clinical trial-based, latest-generation targeted therapies, the U.S. still leads. For the treatment of common cancers using established, evidence-based protocols, which is the vast majority of cancer cases, Philippine private hospitals deliver comparable outcomes at radically lower cost. That's not advocacy. That's what the data from expat communities and international patient outcomes reporting shows. And critically, the Special Resident Retiree Visa, the SRRV, gives you the ability to come and go from the Philippines freely. If you decide mid-treatment that you want to return to the US for a second opinion or specialized care, nothing stops you. You're not trapped. That flexibility matters. Here's the part that completes the picture. Because raw hospital costs are only half the equation. International health insurance for a retiree in Southeast Asia or Central America typically runs $150 to $350 per month, depending on age, deductible choice, and coverage limit. That's $1,800 to $4,200 a year for coverage with $1 million or more in limits, low or zero copays at the accredited hospitals we've been discussing, and emergency evacuation built in. Compare that to what Medicare Part B plus a comprehensive Medigap Plan G costs in the US, roughly $400 to $500 a month combined, depending on your age and state, and that still leaves you exposed to billing disputes, out-of-network surprises, and the general chaos of the American system. The math is not subtle. Abroad, you pay less for insurance, less for the actual care, and you deal with dramatically less administrative friction. The fear of being financially exposed in a medical emergency abroad for someone who has done even basic preparation is almost entirely unfounded. The much larger and more statistically real risk is staying in a US system that is designed to extract maximum payment at every point of vulnerability. Let's bring this home, because a lot of data just landed and it deserves a clear landing. Penang, Malaysia, a full cardiac event including stents and ICU care, under $7,000. Thailand, an MRI for $180, a CT scan for $120, a cardiac workup for $280. Costa Rica, hip fracture repair and rehab for $14,200 or close to nothing through the public Caja system. India, open heart bypass surgery at internationally accredited hospitals, $7,000 to $10,000, against a U.S. median of $150,000. The Philippines, cancer treatment protocols at 60 to 75% below U.S. cost, with the freedom to leave anytime you choose. The fear of getting sick abroad is one of the most powerful psychological anchors keeping Americans trapped in a domestic retirement system that is, by any objective financial measure, far more dangerous to your savings and your health than any of these destinations. None of this means you move abroad blindly. You visit first. You establish care with a local physician before you have a crisis. You carry international health insurance from day one. You identify the nearest internationally accredited hospital to wherever you plan to live. You do the research. That preparation is not complicated and it's not expensive. It is the difference between a medical event that is stressful and manageable and one that wipes out everything you've saved. The world has built remarkable hospitals in places that charge a fraction of what American hospitals charge for the same care. The only question is whether you're willing to consider the possibility that the story you've been told about healthcare abroad was always more fear than fact. Now, if the healthcare piece has you thinking seriously about which countries are actually worth the move in 2026 and which ones have gotten quietly worse, that research is sitting right there on your screen. We ranked the places that are opening their doors to Americans and the ones that have started pushing back, and a couple of the answers are going to surprise you. The world is wider than you think. And the hospital down the road in Penang? It's ready when you are.